Okay, so I'm just gonna go ahead and jump right in. Lots of legislation has been introduced since we, um, as you can see, that list was extensive. There's 8 things expected error happened, and something I don't know, whatever. So hopefully the recording works out. Can everyone still hear me?
Yes,
Okay,
we can
I just
hear
want
you
to make
now.
sure that
You were
the
breaking up
error.
for a second there, but we can hear
Okay,
you great now.
I'm wondering if that unexpected error doesn't have to do something with the weather outside. Because that's my biggest fear right now is I'm either going to lose internet or I'm going to lose power and internet. So we'll see what happens. I feel like every time it storms out this way, one or the other goes down. Thanks, Comcast. But okay, so no new updates right now as far as the budget is concerned. The last I heard, they're in negotiations. Nothing public though. Everything usually leading up to the actual voting on the budget takes place behind the scenes, unfortunately. So as I get information on that, I'll be more than happy to pass it on to everybody. I will say, and I apologize for not including this. I wasn't thinking of it. There is a mental health planning council before our next meeting. So that is taking place on, I believe, May 3rd. Let me double check real quick. No, excuse me, May 13th. So the subcommittees meet in the morning from 10 to 12, and then the larger mental health planning council meets in the afternoon from 12:45 to 3. So again, that's taking place on May 13th. Um, there will be another one that happens in July, and then in September, the plan is that that meeting will happen in person. Nothing's concrete yet. We still have a few details to work out, but that's the road that the planning council is heading down, hoping to get back in person at least once a year, because we all value that in-person networking time because you don't quite get that over the computer. Even though they have a room open for everybody to have lunch together and network that way, sometimes it's a little weird. So, House and Senate session days are there for your viewing pleasure. If you notice, there's nothing really scheduled after the middle of June because that's when they'll pause for the summer break. So, everything that's going to happen hopefully happens by then, including the passing of the budget. They are able to call emergency session days for things like the budget if it gets to that point. But they've gone to break without a budget in recent years, so I'm not going to hold my breath on that. So I'm going to dive right into the legislation because like you can see there's a lot of it. So I mentioned there's a co-sponsorship memo that I didn't include on here for space purposes. So the co-sponsorship memo is has to do with mental health medications and the pre-authorization on them. I'm hoping that it will be introduced before long. There was some positive response surrounding that co-sponsorship memo, so hopefully before long it'll have a House bill number because it's going to originate in the House. But I just wanted to bring that to everybody's attention. Hopefully, I'll have more on that next month, and I'll talk about next month here in a second. So, the House Bill 1002, Protecting Our Students from Suicide, just talks about suicide education and in an age appropriate suicide education. In I believe it was high school for high school students, and more age appropriate for middle school, but still having that be part of the public education curriculum, um, because it's a problem. Everybody knows that, and I don't have to talk about it in depth, but it's definitely an issue. And I'm happy to see that people are starting to pay attention to it instead of acting like it doesn't happen. Well, we haven't heard about that, so it doesn't exist because they haven't heard about it. So happy that those things are coming to fruition. House Bill 1117 talks about the promotion of recovery oriented language, especially in policies and legislative bills, just across the state, how we talk about not only substance abuse recovery, but mental health recovery as well. So interested to see how that goes. So 1128 is incredibly complicated and in the weeds. So I'm going to give you a high level summary and feel free to go in and read the bill at your leisure. It's pretty intensive, so I will warn you of that. But it talks about developing a process to prevent emergency room boarding of Medicaid patients who require behavioral health and long-term care services. This emergency room boarding has been a long-standing issue for decades. And I served on a joint committee guided by a House resolution 2018 2019 part of 2020 that looked at emergency room boarding and potential solutions to kind of alleviate that. It's not a joke when I tell you anecdotally I've heard, of a young person being stuck in an emergency department for like 16 days because they couldn't find a placement. um, Granted, we haven't heard anything like that like that long of a time in quite some time, but we still know that it's happening. Kim?
I just made a face because I'm like, 16 days is nothing. We had a guy in Grandview that was there for 4 months and was stuck in the
Oh
ED.
my
So I'm
gosh.
like,
Okay.
I'm sorry. So if you were wondering what my face was, I couldn't help it. I am on
No,
camera.
that's
So I
okay.
went, wait, 14 days? That doesn't seem that terrible. ED boarding is a
Yeah.
huge issue. So I'm stopped. Oh, sorry.
Yeah.
Shut up. Keep going. My bad.
No,
Yeah,
you're
and I'll just add in there also that older adults are spending a tremendous amount of time in emergency departments, and even after they're, provided a room in the hospital, if that's allowed, a lot of times they don't want to even admit the person for fear that they can't find a placement. And there's reality to that. Anyway, big problem for older adults too.
Yes, ma'am. Agreed.
Thank you,
I just
Lenny.
don't know why this bill's only focusing on Medicaid patients is my concern.
I have a feeling that that has something to do with state versus federal jurisdiction, because Medicare is primarily federal and state handles more Medicaid intimately. Although the money for Medicaid obviously comes from the federal level because that's a big to do right now.
Well, what about
But
private pay?
that I don't
You
know.
see what I mean? Like, why are we, it should just, it's ED boarding is an issue, period, regardless of payer status. At least and
Yeah.
it should be addressed regardless of payer.
Mm-hmm.
Anyway, I'm preaching. I'm sorry.
Yeah.
I'll shut up.
And I think that it talks back into a parity issue as far as private insurance goes. And don't even get me started on parity. You've heard me talk about parity, Kim. So it's a whole kit and caboodle. And I get frustrated, and when I tell you this, that I really think that states should be able to do more for parity and not rely on the federal system to do so. I know we have the Pennsylvania Insurance Department, but mostly their job is to enforce parity, that comes down from the federal level. So props on them for doing that, but at the same time, like that's one of those things that needs to be more in state control and less out of the federal hands. Um, but that's all I'll say about that. Don't want to get on one of my soapboxes. So that's what's happening with that. I'm happy to see again that something's coming of emergency boarding, but again, we'll see how things go. And if I could just pause here before I get into the Senate bills, I have a concern right now. I read this stuff every day. I get emails every day from the various committees. What's NAMI's position on this? What's NAMI's position on that? I'm subscribed to alerts from the PA website, like keywords mental health, and there's a few other keywords that I follow. And I also get a legislative roundup from another one of our partners within the state. She's not on here right now, so I won't give her too many props because I don't know how many people she wants on that legislative roundup distro. But there are a lot of bills being introduced right now as reactionary to what's happening at the federal level, which I understand some of it absolutely needs to be introduced. But at the same time, my worry is that we're worrying more about things that are out of our control in the state legislature than worrying about things that we can have an impact on. Um, and I say that again as someone who gets this information on a daily basis and is inundated with it. There's a lot of reactionary legislation being introduced. Um, and just by the name of the title, when I see some of these, you can tell who's introducing it. And when I say tell who's introducing it, I mean Democrats or Republicans. That is what it is. But it's more than half of the bills that are being introduced right now are reactionary legislation to what's happening at the federal level. So again, I'm concerned about that because we're not working on what actually needs to be worked on within the Commonwealth, things that we have control over. So,
Nikki, can I ask you about that?
Yeah.
Because I will tell you, we had a meeting with Christine, and for whatever reason, my computer's acting wacky, and I can't see who's on. Is Christine from Montgomery County on with us today?
No, she's not. Wait,
Yes,
she.
I am here. I'm here.
So
Yeah, you were on my second.
So Christine, do you want to just give an update about what we talked about? Because I think it aligns with what Nikki is saying a little bit, and talk about what we're doing as far as that legislation is concerned.
Yeah, I mean, hold on, my camera's not on. Sorry.
That's
Here
okay.
I am. Yeah, I mean, so through the CAN collaboration, we were talking about creating a day of advocacy up in Harrisburg. And so there were, there's a couple of different things that we've been planning to talk about with legislators for a while. And they're all like mental health parity. They're all very important issues. But one of the things I brought up is my concern about, this issue around Medicaid. And if Medicaid is cut, what are we talking about? Like these other issues at the state level, like I'm having trouble sort of putting my head around this because of those federal issues that Medicaid potentially could be cut. Like, how do I talk about mental health parity? How do I talk about any of this stuff? Because Medicaid's gone. And we don't know that yet, but I'm having trouble figuring that out. And so I think one of the things that, and I reached out to you, Nikki, after the meeting I had with them about sort of what are the priorities or things that we should be talking to state legislators, given what's happening federally. Like, what should we be pushing? Did I cover it, Kim?
Yep.
Hey, Christine, I did reply to your emails. I don't know if you saw those.
Yeah, I did see them. I didn't get a chance to look over all of them though.
Yeah. I put both replies in one email as to not clog up your inbox. So yeah. Yeah.
Okay.
And if you in that email, I'm planning on being there on June 4th for y'all's advocacy day. So we can work more one-on-one leading up to that point. Like whatever you guys need from me, just let me know and I'll be more than happy to help out with that. But there is and it really stinks that it's all there's no way right now with everything happening that anybody can be proactive, and everything's 100% reactive right now, and I don't like that at all. I'm more of a proactive person, but with everything that's happening, everything has been reactive thus far. And I'll just stop talking about that right now before I go down another rabbit hole. But yeah, I'll talk more about some of that stuff here in a second. Because there was some things that I put in that email to you, Christine, that I included here on the agenda just because they're applicable to everybody everywhere. So back into the legislation real quick. I did forget to mention House Resolution 133. So that's to study the effectiveness of problem solving courts. And that includes mental health court, drug court, veterans court, all of those things. So that's a House resolution. So House resolutions, the way they work, if you're not familiar with the process, is they put together a committee of subject matter experts, and we spend months and months and months peeling through all of this information. And our job as the committee, or the job of the committee, is to come back with plausible solutions. So when I say plausible, I mean things that can be done at the state level to kind of circumvent some of the problems that have been identified. I will tell you now, just reading through that House resolution, that one of the big problems that has been identified and it's something we've talked about before in regards to the Mental Health Procedures Act, is the lack of uniformity of one specialty treatment court to the next, county to county. So on that note, there was also a bill introduced in the Senate regarding strengthening Pennsylvania's treatment courts. A lot of the similar language. I will tell you that the strengthening Pennsylvania's treatment courts, one of the things it talks about in there is credentialing these court systems. So there are, especially for drug courts, there's some kind of credentialing body out there, and you have to meet certain benchmarks in order to be credentialed for drug court. So that was one of the things that's mentioned in the Senate bill, is having that be applicable all across the Commonwealth, some sort of credentialing system to keep that uniformity from county to county. So I was pretty excited to see that, because I, again, anecdotally hear, and I'm sure everybody who has a helpline, everybody who has a NAMI helpline, hears all of the horror stories about things that go wrong during some of these specialty courts. And yeah, it's kind of wild. So I'm also say too, I'll be at the CJAB conference next week. So if anyone else is going to be at the CJAB conference at Penn State, you see me, come say hey, please. I'm interested to see in particular the results of the Council for State Government CIT survey, because that's another thing that is something that NAMI pays close attention to, what's happening with CIT programs across the Commonwealth, because they're very much the same but very much different. So how do we get everybody on the same page as far as that goes, so we're receiving equitable treatment, or not equitable treatment, equitable training across the board, so everyone's on the same page. So this one's kind of cool. Senate Bill 492. There's a movement to put 988 on college IDs. Again, going back to what we talked about with protecting our students from suicide. Suicide continues to be a leading cause in death amongst the transition age population. And this is just one of those things I'm happy to see Pennsylvania considering to get the word out about 988. I haven't talked about 988 on the policy call for quite some time, because quite frankly, I'm frustrated that it's not moving at all. I won't even, it's like pond water's moving faster than 988 is in Pennsylvania. And it's frustrating to me because I live in Ohio, and Ohio is a red state right now, and Ohio is doing 1,000% more for 988 than the state of Pennsylvania is. Like, I just got my state tax bill in the mail, and 988 is stamped on the back of the tax, like from the Ohio Department of Taxation. Like, 988, call 988. I see billboards everywhere. I have, when I'm reading through articles on Facebook, like there's 988, like sponsored by the Ohio Attorney General's office. I get those pop-ups and advertisements to send to the games I play. So I'm like I said, I haven't talked about 988 for a minute because I'm frustrated that nothing's happening with it. So the state is in the process of reworking their 988 advisory committee and things like that. So hopefully in the coming months we'll have some more information, but there's not a whole lot happening right now.
Hey, Nikki.
Yeah.
Didn't we talk about this in the past, that they were also looking to put these on high school student badges? Was that something that I remember you saying? Was that also a bill? Did that do anything as far as make any movement?
No, it was from last session, so it went away and it's got to be reintroduced. I didn't see the mention of high school IDs in this particular piece of legislation, but it definitely specified college. So
Okay, thank you.
no worries. Give me 1 second here. I'm sorry. Okay. Sorry about that. So the collaborative care model is the legislation is similar to what was around last session, but different. And it talks more about ways to integrate mental health care into primary care. How do we get more ICWIC's within the state. So ICWIC is what Pennsylvania uses. I don't remember what the acronym stands for, so pardon me because there's so many of them. But the rest of the nation used the Community Care Behavioral Health Center model. So ICWIC is Pennsylvania's model of that, and so it talks about strengthening that collaborative care from primary care and mental health and bridging those gaps. So potentially individuals don't necessarily have to be seen by a psychiatrist, and like lengthen out that process of them getting treatment. So, and these are all high level overviews. Again, like some of these pieces of legislation are pages and pages long, and I encourage you to read them on your own. And if you have any questions, feel free to reach out at any time. I feel like I read legislation for sports some days, so like no question is a dumb question. So please feel free to reach out. And then the final one is a bill that's getting pushed through the House and the Senate simultaneously. It's for the social work licensure compact. So that'll allow social workers to have a license in one state and practice in another without having to get their license again. And part of that is the requirements are very stringent. It's a costly process to get your license in every state that you practice in. Various states have different rules for testing. Various states have different rules for CEUs. Although they all follow the NASW guidelines. Again, guidelines are just that. They can't take away from those guidelines, but you can always add to those guidelines. So some states have a more complicated process to obtain their license than others. So what this compact will do is ensure that as long as you have a social work license in good standing, you can practice social work in Pennsylvania, and that'll go a long way to fixing the provider shortage that we're facing. I'm not going to take care of it at all, like entirely, but it'll definitely help out significantly. Okay, before we move on, does anybody have any questions about that?
Nikki?
Yes.
So for the social work compact bill, if anyone wants like a little handout, NASW put something out for their advocacy day. So it just gives a little summary of what they're asking for.
Thank you. I appreciate that. Can you send that to me, Christine? Thank you. Okay, so I attached a separate document with the federal updates. Excuse me, those federal updates have come directly from NAMI National to my inbox. Everything's current as of Friday, February the 11th. Or not February 11th, Jesus, April 11th. Not trying to press rewind. Yeah, so everything's current as of Friday, April 11th. You can read that on your own. There's entirely too much on there for me to like succinctly summarize everything, but it talks about what's happening at the federal level with Medicaid, what's going on with some of the executive orders and the other random orders that President Trump has passed down. It talks about legislation that NAMI National is watching. There's like action kits in there with talking points, things of that nature. So, and if any of you, especially my NAMI folks that are on here, I'm sorry, it's not open to other NAMIs. If any, or other agencies, if any of the NAMI folks on here aren't receiving those emails but would like to, let me know and I will put you in contact with the person who's sending those newsletters out. I don't like that I'm not allowed to share outside the NAMI Alliance, but I understand. So that is what it is. Okay, so finally the miscellaneous. This is kind of cool. And apparently it's existed for quite some time and I had no idea that it was a thing. DHS has a data dashboard. We've had a lot of requests for Medicaid information at the county level, and you can find all of that information on the DHS data dashboard. and you can drop it down by county, you can do it by region, you can see everything across the state of Pennsylvania. They also talk about SNAP, and there was one other thing that they talk about on there in particular. And then if you scroll all the way down to the very bottom of it, right before you get to like the website breakdown, like policies, about us, etc., one of the very last links on there is information specific to mental health. So it takes you to a different webpage, not the DHS data board, but there's lots of good information about mental health services across Pennsylvania. And again, it's from the state perspective, so we know that's not necessarily an entirely accurate picture. And I'll tell you too that the state data runs fairly behind as far as mental health is concerned, especially if it comes to Medicaid, because the BIMCOs across the Commonwealth are on like a 6-month data lag. Just the way they process their billing and all that other stuff. So all of the information that will be currently available regarding the mental health stuff on these websites is probably like 6 months to a year old. I'll just give you that warning now. But it's there. It is a great resource. I've poked around there and looked through a few things already. So, and if anybody, if any of you ever come across some kind of database like that, and would love to pass it on, just let me know and I can get that to everybody. Because I feel like sometimes data is our best resource, especially when we're going out and we're talking to legislators. They like data, they like facts. So stories are important too, but they're all about like concrete things that they can see and act on. So data is always a plus. So Christine Lutterer and I spent some time, mostly Christine, working on the next item, miscellaneous B. So that is a comprehensive, spreadsheet of all of the legislators across the Commonwealth for every district, both Senate and House. In there is their contact information, what committees they serve on, and what NAMIs like fall under that particular district. I had Christine help me with that because her and I ventured down the same social work path in grad school, and she's also our affiliate liaison if you hadn't had a chance to meet her yet. So she's helping us at the Keystone office kind of wrangle the regions that everybody covers, so we have a more accurate, complete picture of that. So I was happy that she was willing to help me with that spreadsheet and identify who belongs to what, if you will. Again, talking about which NAMIs fall under which districts, what everybody serves on, the various committees, things of that nature. So that's important because sometimes the same representative or senator will serve on a committee that maybe a bill is impacted twice by that committee. I know that sometimes, a bill will have to go through X, Y, or Z committee before it hits appropriations committee if there's a fiscal note attached to it, or maybe it like this with this social work licensure compact, it's in licensing right now. However, I have a feeling it's probably going to go through other committees. And I say that, Health and Human Services, that's kind of where I'm thinking at. So it's also good to know if you have a legislator that serves on 2 committees that may be impacting the same piece of legislation. Because that's not all a question. It doesn't happen very often where a piece of legislation has to go through multiple committees, but it does happen. So affiliate listening session results. So Christine and I conducted an affiliate listening session last Thursday, 2 Thursdays almost now, about what the affiliates in particular would like to see from the advocacy department, from me, how I can best help you all out. We got lots of great feedback, and I'll tell you some things that came up in particular over and over again were Medicaid. That came up several times. So working on that as quickly as possible, as thoroughly as possible, but most of it's coming from national. Mental health advanced directives. There was a huge movement across the state. Probably like not quite 10 years ago, because it was still happening when I came to NAMI 7 years ago, so more than 5 years ago, where there's huge push for mental health advanced directives trainings for individuals, for providers that might be helping out people fill out mental health advanced directives, things of that nature. Well, since that time, the focus has shifted to other things. As we all know, I mentioned, we're pretty reactionary in this space, and although we try to be proactive. But mental health advanced directives has come up. It's also come up in the context that providers think they don't have to follow somebody's mental health advanced directive. So working on some things to get accurate information out to everybody. Another thing that we heard about was reintegration, and what happens when somebody is leaving the criminal justice system, and the appropriate steps to take. And we know that there are reintegration agencies and professionals out there. It's so windy out. um, so trying to connect as many people with them as possible and offer everyone on here presentations. So this isn't just going to be exclusively to NAMI affiliates. Anyone that's on this policy call list is more than welcome. So Christine and I are we're going to meet again in the future and build a schedule out. And I will say that those are going to start happening in addition to the public policy call. So these presentations will not take the place of the policy call. We'll still have the policy call, but so they'll be in addition to. Also going to start doing more NAMI Smarts trainings. I'm trying to find a way to figure out how I can record them and house them somewhere. So that way it's kind of like NAMI Smarts on demand, if you will. So I know the premise of the Smarts program is interactive, but I know there's a way we can be able to do this to get the information to as much people, to as many people as possible. And that will not, like, if I'm able to do that, that won't take the place of me going out to CSPs and other groups and giving NAMI Smarts training. But people are interested in some of those modules, and it's easier, if you have an hour on a Tuesday night and you want to watch that's easier than me trying to get everybody on the same page, make a schedule, find a co-facilitator, etc. So working on how we might be able to do that without violating any kind of NAMI proprietary considerations, concerns, teaching, delivery, stuff like that. So working on that, working on this plan. Christine and I landed on the fact that we're going to start rolling all of this stuff out in the fall, after we move through the summer. Everyone knows May is Mental Health Month, and it's going to be bananas. It is every year. Also lots of other trainings and things that are going on over the summer. So we're gonna take the summer, line up some additional trainings based on those topics, and then we'll roll out a schedule in the fall for all of that stuff. Christine, did I miss anything? Christine says no and gives me a thumb up. Perfect. So, anybody have any questions so far? Okay. So, Advocacy Day is going to be on May 6th at the Capitol Building Rotunda. NAMI Keystone, me in particular, has helped plan some of this. This is not a NAMI Keystone event. I repeat, this is not a NAMI Keystone event. We are helping the primary organizers with some of the things. I make the save the date, currently working on the flyer. NAMI Keystone will be sharing a table with NAMI Dauphin and NAMI Cumberland Perry at that event. I will tell you, if you are coming out on May 6th for the event, I'm putting together folders. So right now I have a legislative priorities document. I sent that out at the beginning of the year. I think it was January for our first policy call of the year. I'm working on updating that. Updating some of the language to be more specific to what's currently happening with everything at the federal level. Also need to go back through and previously when I had sent that to the House committees and the Senate committees, the new legislative session hadn't started yet, so everything that's on there currently is old bill numbers. But the point of this document, it's going to be a living document, so it's going to get updated as new legislation continues to be introduced. as things change. Right now, there's only 3 priorities on there, and if need be, we could add another 1 or 2 of them. So I'm hoping to be able to house that in the cloud somewhere and still give everybody access to it. I know it's possible. I just don't know that process. So that way, if you have a meeting with somebody and maybe you have a version from 3 months ago, you can just go click this link and you'll be able to download the most up-to-date version of that. We'll see. I'm not sure how that works out. IT is not my strong suit. That's why I do the job that I do. Even this is a little challenging sometimes hosting virtual meetings. But all that to say, like I said, I'm going to have packets put together on Advocacy Day, May 6th, with the NAMI talking points, with some Pennsylvania fact sheets, that Medicaid sheet. There's a criminal justice fact sheet. There's a PA state fact sheet that NAMI National has issued. So I'm going to have, yes, we're now absolutely send those documents out. And I'll do that for everybody. I don't know when, before the end of May, I will put that together, that packet, and get it sent around to everybody. So you have those documents if you do legislative visits independently. So the day starts at 10 in the morning with the resource tables, legislative visits. We're going to break for lunch at 12 on everybody's own, and then we'll come back and reconvene in the rotunda at 1 p.m. for a press conference. And Representative Schlossberg scheduled to speak. Jen Smith, the Deputy Secretary from OMSAS. There's going to be individuals with lived experience sharing their stories, family members with lived experience sharing their stories. So hopefully it's a really impactful day. I don't know that we'll be doing a march around the Capitol. I advocated for that because that's the fun part for me, at least. But I seem to be the only one that is interested in doing that. So that's what I can offer right now about Advocacy Day. So hopefully, I know it's happening during NatCon, but hopefully I can see as many people as possible. So, Kim, did you have a question?
Always, Nikki. Sorry, and I'm supposed to be a guest here, but I'm so. So, just my question on Advocacy Day is: are you going to be, as we're preparing for the Bucksmont Collaborative Advocacy Day? I'm trying to really bring awareness around current legislation that we are supporting. So, is NAMI doing the same thing? Like in your talking points, or if they're not established, will you share them with me? Because I want to make sure that we're not just talking about the issues, but really advocating for those proposed solutions.
Yes. Mm-hmm. Yeah, that's how the way I have it organized right now. Like each priority has a little description, and then there's a little spot at the bottom that'll highlight legislation that is a potential solution for that issue.
Cool.
Yep. And I'll be there on June 4th. Nick invited me. I hope that's okay.
Of course it is. And I'm really trying to come May 6th, but I get married the weekend before, so I'm not sure if I'm back at work. So,
look, I get it. That's why I said fall too, because I'm getting married over the summer. So it's like, yeah, I got stuff.
My family's still in town. I'm trying to decide if I'm blowing them off or not, etc. So anyway, but I really do want to be there. But anyhow, thank you.
Yeah. Listen, we were my fiance and I were well into planning an actual wedding ceremony at a location with friends and family invited, catering the whole 9 yards, and something popped up, and it's like, let's just elope. And so now we're going to Colorado and spending a week in Denver, and we're gonna get married while we're there. So
good for you.
Yeah, way more stress-free than catering and coordinating cousins and making sure everyone has somewhere to stay. And yeah, so
yep. I should have followed your lead, Nikki, but yeah.
Yeah, no. Yep. Mm-hmm. So listen, there's not going to be a meeting in May. Like the normally scheduled policy call is going to be taking place during our annual NAMI Keystone Pennsylvania Health and Wellness Conference in Harrisburg. So that Tuesday, since it's policy call day anyway, Chris Michaels and I will be giving a legislative brief first thing in the morning, and then in the afternoon, thanks Lynn, and then that afternoon I will be giving a workshop, and the title of that workshop is going to be Policy Making 101. And I'm going to talk about what happens at the federal level, what happens at the state level, what the movements are of a piece of legislation once it gets introduced. I'm going to touch on regulatory changes and how those happen incredibly slowly. But they happen. I'm also going to be talking about spend some time talking about the difference between advocacy and lobbying because it comes up frequently, and there's a fine line that we have to dance around because we are a nonprofit organization. So I'm gonna highlight that in my presentation as well about what constitutes lobbying and what needs to be reported, etc. And how what we do is actually advocacy and the way that we do those things to differentiate ourselves from lobbyists. So hopefully I'm going to see some familiar faces there. If that workshop interests you, please come join us. I'm excited that I'm going to be able to do that for everybody because again, these are questions I get all the time, and from people outside of NAMI. How does the process work? So I'm going to take everything that's floating in here and try to put it on a PowerPoint and make it make sense for everybody. And try to make it be as comprehensive as possible. So, no meeting in May. I'll also tell everybody now there's also not going to be a meeting in July. That's when I'll be in Denver getting married. So the day that our meeting's supposed to happen, I'll actually be in an Eric Church concert. So I'm pretty excited about that. But yeah, I'll be that'll be the week I'm getting married in Denver. So we won't have one in May and we won't have one in July. And then hopefully we can reconvene in like August, September sometime. So, and unless anybody has any questions, thoughts, comments, concerns, that's really all I've got for today. Anybody? Thank you, Renaud. Thank you, Jamie. I appreciate y'all. It's an exciting time. It's a super exciting time. Jamie, I see where you asked about me cutting out. Yeah, it's just the weather, I think. So, but yeah, if nobody else has anything, enjoy the rest of your Tuesday. And if you need anything, give me a shout. Bye, all.
Bye-bye. Congratulations.
Yeah,
Thanks so much.
congratulations. Thank you, Nikki. Thanks, Kim.
Bye, Nikki. Everybody have a good
You too.